Welcome back to it, guys. Your Wednesday edition of the Now Morning Show continues as Breast Cancer Awareness Month is also in the month of October. So this morning in our spotlight, we shine a light on self-screening for new and breastfeeding moms.
Inside your spotlight this morning, we continue to observe Breast Cancer Awareness Month, and this time we focus on self-screening for new and breastfeeding moms. To do that, let me welcome nursing and midwifery consultant, Quista Harry Richards. Good morning to you, Quista.
Good morning, and good morning to Trinidad and Tobago and your viewing audience.
Thank you so much for joining us this morning. Tell us a bit about your journey. What inspired you to become a midwife and to dedicate nearly 2 decades to supporting women through motherhood?
Well, I've been in nursing and midwifery for almost 2 decades. My experience really began in the operating theater.
Okay.
Right?
You started in the operating theater?
Well, I spent a great deal of my experience there in obstetric and gynecology departments.
Okay.
And while working there in the public system, you know, you would have seen the midwives coming in to receive the baby. While I was at the table helping to deliver that baby, I would hand the baby over to midwives who would come in and take up the care from there. And that's where my interest grew in the profession, and I decided to specialize. And that journey for me has been a wonderful experience. Walking beside women during that journey to motherhood is such an incredible experience, bringing birth into this world. And so I've moved a little bit now to providing individualized care for women, allowing them to feel empowered in their journey to motherhood.
Now, you often talk about compassionate and evidence-based care. What does that mean in terms of the practice for you when you're serving the women and the families?
As a midwife, it really means being with women. So you are walking beside this woman for her entire journey.
Oh, for the full 9 months?
Well, even before that.
Okay.
In the preconception stage, which is where she's planning to have a baby,
Right.
when she actually gets pregnant, during the pregnancy, and then postpartum.
Okay.
So it's really building a trusting relationship with that woman, and it speaks to her cultural beliefs. It speaks to, you know, the things that matter to her, and allowing her to have a level of autonomy in her care. Yes?
Very interesting.
While evidence-based speaks to giving her all the knowledge and information so that she can make informed decisions. So that's what compassionate evidence midwifery care speaks to.
Now, according to the World Midwives Association, the campaign that they have going on now, compassionate care begins with access. You mentioned giving the information. You mentioned all of that just now. Tell me why this initiative is so close to your heart.
Well, the service I provide is a bit different from what the woman will experience at the antenatal clinic, let's say in the public health system.
Right.
Because after you see your specialist, the doctor or midwife, and you go home, before the 36-week period, your next appointment is a month away.
Right.
During that period, if anything troubles you, you have to return to the hospital
And sit
setting.
down and wait.
Yes, and that is, I'm glad you mentioned that, because that could be a deterrent. I have to go through this all over again. But having a midwife who walks that journey with you, remember, we have built that trust and relationship. So access means you are able to get on a call with me. You are able to ask questions that may be intimidating in a setting like the public healthcare system, where, you know, there are 50-odd persons waiting to be seen, and this visit is just a 10 minutes or less. You know, so that is what access speaks to. And also, it doesn't discriminate. It doesn't discriminate. We have quite a few immigrant mothers as well, and that means extending care to them as well.
The language barrier is ever a problem?
Well, it is, but they understand more English than we think. And there's always a way to communicate. And midwifery is a hands-on profession.
Yeah.
You are palpating, you are inspecting, so the communication is not as difficult as it seems.
Yeah. Now, this month's focus is breast cancer awareness. Why is it important for breastfeeding mothers in particular to include self-breast exams as part of their postpartum care?
Well, Rokas, you have seen breast cancer awareness all over. Scotiabank, other agencies have been, raising that awareness. Have you heard anything specific to the breastfeeding mother?
Well, no, I didn't think it was different in terms of what you have to check for. So, I mean, forgive me for my lack of knowledge.
Well, not a difference in terms of what you do, but the period in which you would do that examination.
All right, tell me more.
So we usually say 6 to 8 weeks postpartum is when you would do that self-breast examination. Why? During lactation, during breastfeeding, the breast goes through many changes. The tissues in the breast, the cells are restructuring in order to feed this baby.
Right.
And they are in a constant stage of development. So that the mother also experiences tenderness in the breast during that period, in the early periods. So 6 to 8 weeks give the mother time to, settle in her breastfeeding routine, and the breast is not as, tender around that time. So
Are you talking about the tissue on the inside?
Yes.
Because I know the outside remains tender for the entire period of breastfeeding.
I'm glad you mentioned that. So you want to advise the mom to do her self-breast examination after she's been breastfeeding. So after a session, when the breast is softer and not as tender, that's the time you would do it. And of course, wait 6 to 8 weeks to actually begin.
This is after giving birth?
Yes.
Tell me, what should they be looking for?
So I tell my mothers there are 2 ways you can do this. You stand in front of the mirror, or you can lie on your back. And the first thing is to really examine the breast. You are looking for any changes in the breast, the skin itself. The skin you're looking to see if it appears normal or if it appears like an orange. The skin of an orange looks like there are pores on it. Right, that would be an abnormal feature.
Okay.
You are observing the nipple. Is it inverted, meaning it goes inwards, or is it protruding? Is the skin flaky around the nipple? Is the breast larger? Are they the same in terms of size and position, or is there any significant difference in the size?
Let me ask a question about that point, because when you're breastfeeding, I imagine if you use one and the child is fed and full, then you will have a difference in size.
You sound quite knowledgeable.
And I have a child, so I went through it at some point, right?
All right, so let's begin with one side of the body is always a bit larger than the other. So let's start there. However, that change must not be very significant.
Okay.
All right, and yes, as you mentioned, sometimes the baby prefers one particular breast over the other, and that could result in one being larger than the other. All right, but things like a lump in the breast, that doesn't go away. Now, it's expected to feel nodular because there are ducts in the breast, and that's where the milk is stored. Right? So that's why the time frame is important.
That's 6 to 8 weeks.
6 to 8 weeks, and after you have breastfed and the breast is now, baby has
drained it out,
and the breast is softer and not as tender as before. And if this lump lasts beyond a week, then it's cause for concern, or it's painful.
And that's the part I wanted to ask about, because, I mean, you mentioned so many changes are happening, and of course, we know that so many changes happen in a woman's body at that point in time. So the difference between what might be a normal change versus what might be a change that might require medical attention. What are some of the red flags? I mean, the lump is obviously one that lasts for longer than a week.
More than a week.
Right.
Redness in the breast. We spoke about the skin, the integrity of the skin, if it appears like grapefruit or orange. Flakiness at the nipple, discharge from the nipple other than breast milk. So blood or pus that comes from the nipple that is abnormal
Definitely
and
red
raises
flag.
a
Yeah.
red flag.
Okay.
Yes?
Nice. Tell me how midwives and healthcare professionals can help to bridge that gap to make it, or maybe what advice you would give them to help bridge that gap to make it more accessible, to make it more compassionate, to make it more all-inclusive.
Awareness. And that starts from preconception.
Of course.
So there are many touch points with the client and health professional. And we have to use those touch points to educate at all costs so that the women are more informed, they are educated, and there's no reason that a woman shouldn't know about self breast examination, how it's done, and everything we've discussed here about what's normal and what's abnormal.
Now, I saw you brought a prop on set. Are you going to show us how to do the self breast
Yes, I'll be
examination?
happy to.
Go ahead, let me go.
Okay. So here we have the breast model. And
Turn it the other way so that the camera could be
okay.
here.
And we will be focusing on the outer portion.
Right.
But I must say that self-breast examination really begins in the underarm. Why?
Underarm.
Yes.
Okay.
The breast tissue extends into the underarm.
Okay.
So you always start there. And you start by palpating, right, all the entire surface of the arm. When you have completed that, and you do that using the pads of your fingers.
Okay.
When you have completed that, you can now work on the breast. And you start on the outer portion of the breast, right, using the pads of the fingers, going all around until you have come into the center of the breast. And when you reach the nipple, you press down on the nipple to ensure that there's no swelling or any nodes under there. All right? And you always compare, you repeat it on the other breast, and you always compare what you have felt on one breast to the other.
Okay.
Right? If there's a difference, then you need to seek medical attention, maybe to have other tests done, such as a mammogram or ultrasound.
Okay. So from the
Yes.
time you feel that difference between the two, it's another red flag that you can say, let me at least go seek medical advice.
Well, if you have been doing this, the idea is to practice self-breast examination.
Right.
Right? And the requirement is really once every month.
Okay.
Right? Try to do it the same time every month so that you can identify, okay, this is my normal breast tissue. So when something abnormal occurs, you can identify it quickly, and the idea is to seek medical care as quickly as possible to ensure better outcomes if there's an abnormality.
Fantastic. Now, finally, what message would you like to leave with breast cancer, with mothers, for this Breast Cancer Awareness Month?
I don't want women to fear doing their self-breast examination because they may find something abnormal.
Yeah.
I want them to be empowered by knowing and having that knowledge and what that knowledge can do. Right? You know what's normal, and if it happens to be abnormal, you can get help and treatment as soon as possible.
Now, just quickly, outside of mothers, new mothers, and breastfeeding mothers, all of those same rules apply to just women across the board?
Across the board.
The same way that you would test is the same way that they should be testing as
Yes.
well. All right, fantastic. Krista, thank you so much for joining us this morning and for sharing your knowledge and for bringing this level of awareness during the Breast Cancer Awareness Month.
Thank you for having me.
Not a problem. Ladies and gentlemen, Krista Harry Richards, nursing and midwifery consultant, sharing with us this morning how we can, well, be a little bit more self-aware and do your own self-screening for new and breastfeeding moms in particular. We take a quick break and we come back with more on In Our Morning Show. Stick around.